Let me start with the Affordable Care Act and its replacement here proposed by the Republican members of the House of Representatives. How different is this legislation than what you thought it would be? You were in Washington a little over a week ago meeting with the Secretary of Health and Human Services. Does this look like you thought it would have looked like?
Well, we didn't really have any predictions because this group that has voted 40 times to repeal Obamacare has never come up with a plan, so we didn't know what to expect. I have to tell you, we are not happy that people in my state, health care is jeopardized by this plan. We have 750,000 people who today have health insurance for their families. We have 20,000 people who've been treated for cancer in my state. And those people's health are jeopardized by this plan because there's a couple things we know about this plan. Number one, it will reduce people's health care coverage in my state in the tens or hundreds of thousands of people. And that is morally indefensible in order to simply justify the tax cuts for the wealthy that is really the altar to which the Republicans worship. We worship health in our state, so this is not satisfactory.
When you were in Washington meeting with administration officials, what did you convey to them? What did you say you wanted to see in any sort of reform legislation?
Well, a couple things. Number one, we want to see people not lose their health care. Look, this is a very personal thing. I met a woman in Spokane, a small business owner, who was never able to afford insurance until the Affordable Care Act. She got it, then found a lump, went in, got her cancer treated. She said, look, without this, I'd be dead, literally. And those stories can be told by the tens of thousands across my state. So the first thing I asked both the president, or actually to Tom Price twice, who is their quarterback on this, look, can you tell us this is not going to take people's health insurance away from them? And they could not give us that assurance, and there's a reason for that, because they understand, almost with malice of forethought, they know this is going to take away health insurance. It's designed to do that in our state. So that was number one takeaway. The other takeaway is that, look, this is just a way, they're looking at health care as a piggy bank to take money to give tax cuts to the wealthy in the hundreds of millions of dollars. And it's designed to do that, and it was designed basically to put this burden on the states. And that's why you're getting pushback from Republicans from these, to put the rock in the pocket of the states. We don't have about $1.5 billion we would lose in my state as a result of these efforts. So a plan that takes away health insurance, a plan that bankrupts the states, this is not something that's really based on health. It's based on an ideological, jihad against the president's achievement. And I think that's really unfortunate.
How much do you know about the financial implications of this on Washington state at this point, again, just 2 days after we saw the first draft of this legislation?
Well, we've looked at a fairly good analysis. It would be about $1.5 billion loss over time because of the restriction of Medicaid funds over time. And one of two things would happen. We would have literally hundreds of thousands of people lose their Medicaid in the years to come, or the state of Washington would have to somewhere come up with about $1.5 billion a year to finance that. The states do not have that capacity. We entered into this Medicaid expansion, both Republican and Democratic governors, with the understanding the federal government would help on this. So reneging on that commitment is unacceptable to us.
Let me ask you about the travel ban. You and Washington State both instrumental here in getting the White House to revise that executive order. Now that you've seen the latest iteration of it, are you happy with what you see? What needs to change, in your opinion?
Well, we've taken some comfort that we've had some real victories. Look, the president has been in full-blown retreat on this. We forced him to retreat on green card holders. We forced him to retreat on folks from Syria and Iraq. We forced him to retreat. He had a prioritization against one religion that has now been stripped out of the bill. So we've had some major victories. The president, despite the fact that he said he's going to see us in court, has backed down in major ways. That's good. The fact is, this continues to reduce the effective compassion and empathy Americans have shown historically for people from war-torn areas. It purports to cut the refugee program in half. And anybody who's seen the pictures of these poor people in Syria, our compassion of this country was not reduced by 50% when Donald Trump took the oath of office. And so that's very regrettable. So we're evaluating our legal options right now. Our Attorney General, Bob Ferguson, who's done some great work, is looking at our options right now to see what we can do.
Yeah, we saw Hawaii today file suit to temporarily block the enactment of this latest executive order. Is that something that you're weighing, something that Washington State is likely to pursue?
It's a possibility. We're looking at those options. We're talking to some of our businesses right now and our universities because, as you know, we were able to show we had standing to bring a lawsuit because this would degrade the ability of our businesses to sell our products overseas, to bring researchers to our universities. Shoot, we were able to get an HIV researcher into this country because we beat the president in court. So we're evaluating that, and we're going to make the right decision. But one way or another, we do not agree with even this existing proposal. It is unfortunately in keeping with the president's expressed intent to have a Muslim ban. We know that was the intention to begin with. They've tried to dress it up. But whether or not there's a litigation, I don't believe this is good policy. It's not consistent with the historic compassion and strength of this nation to be a place of refuge. And I think that's disappointing.
Governor Inslee, last question here. We saw opposition at the state level to the travel ban. We're seeing it now to these changes to the Affordable Care Act. Are we seeing a new strategy start to emerge here that opposition to federal government action is going to take place at the state level among you and your fellow governors?
Well, they call it the United States of America, and the states are the place to resist the violations of the Constitution, to resist this mood of fear-based fanning the flames of hatred in our countries, to resist an effort to take away health insurance from Americans, to resist this effort to ignore the clear science of climate. You bet, states are where the place these battles are going to be fought. Washington's demonstrated we can win this. We'll keep fighting.
Governor Inslee, thanks very much. Appreciate your time today.
Thank you.